Eric, let's go look at the data for the day. Cases, you can kind of see how they're going up a little bit and then down. But again, they're below the 21-day average, which is good. Hospitalization's a little bit above. ICU admissions a little bit down from there. We'll go to the next one, Eric. 88 counties ranked by high occurrence. So this is the chart that we've been showing you for some time. And again, it is try to level things out between counties based on population. It measures the amount of COVID for the last 2 weeks per 100,000 population. So it evens everybody out, and then we can take a look at that. And if you recall, we set the state goal. If we can get statewide below 50, then we'll be able to take off the health orders. We have ways to go. I'm going to show you in a minute that we've really made some progress here. But let me look at this. The white counties. The white counties are counties that are now below 100. The counties that are in blue are those above 100. 100 is high incidence level. So still, most of our counties high incidence level. But the good news is the number of those below 100 are going up. And so you can see this line continues to creep up, and more of the white counties. So that is great. Eric? Again, this goes from the top, and you can see the number generally is coming down. Even the highest county, which is, I believe, Washington County, is 275, and there was a time when that number was 1,100 for the highest county, 1,200. So that's great progress. We told you that every Thursday we would give you the new number, the statewide average. It has gone down. In the last week, we are at 155. 155. So let's talk a little bit about this data. The number of counties below the high incident threshold, as I said, continues to drop, and so do the number of new cases across the state of Ohio. Last week, we were a little below 180 cases per 100,000 in that 2-week period throughout this for the whole state of Ohio. As of today, it's gone from that a little bit below 180 to 155. That is great progress. This is still a highly elevated level. It's above what the CDC says is high incidence level, but the data is certainly trending in the right direction. So now we're going to look at a new chart, and this is a chart that I asked our team to put together. This shows the statewide average of cases per 100,000 residents for a 2-week period since March of last year. You will see that our peak was at 845 in mid-December. Today we're at 155. And let me go through, Fran went through for me, pulled some of this data just a moment ago, and I'm going to read by month. And this was in May. At May, we were at 43. June, we were at 46 statewide. By July, it had gone up to 114. August, it was 70. September, 75. Then we start taking off. October, and these are all the latter part of the month. So September, it's September 23rd, we were at 75. By October 28th, we were at 200, and then by November 25th, around Thanksgiving, we were at 750. Then in December 16th, we were at 845. And then January 20th, we were at 620. February 10th, we were down to 340. And now, March 10th, we were at 155. So nothing is guaranteed when we're dealing with the virus, but Ohioans have done very well, keeping the mask on, doing what we need to do, this number continues to come down, and I'm very, very hopeful that we will continue to see that occurring. Let's go to the hospitalizations. We had a little blip yesterday, day before yesterday, I guess, went up a little bit, but the trend line, it did jump here quite a bit, but we're down to 908. So the trend line, the overall trend line, is still good. Let's go to our old traditional alert map. You'll see some changes. We're also seeing more counties move off of red in the advisory system. This week, 9 counties are moving from red to orange. Those are Adams, Darke, Guernsey, Harrison, Knox, Morgan, Preble, Putnam, and Van Wert. They're primarily moving down because their cases per capita have all dropped below the high incidence level of 100. We also have 1 county moving from red to yellow, and that is Meigs County. The case rate in Meigs County was well over the high incidence threshold last week, but this week they've dropped to below 50, which means they no longer meet the cases per capita indicator at all and are now at yellow. We do have a bit of upward movement. Holmes moved to orange. This is because their cases per capita increased from just under 50 to about 60 this week. It's a small difference, but it does mean they go back to orange for this week. Even with this increase, they're well below the state average. We'll keep a close eye on their status. Just a reminder that we could hit little bumps in the road in our journey out of this pandemic, and in all likelihood will, but we shouldn't be discouraged. We should keep our eye on the ball and continue to move forward.